Hello, I'm Julia Macbeth, Director of Research and Advocacy for the Celiac Disease Foundation. Thank you for joining us today for the State Advocacy Ambassador Training. Celiac Disease Foundation advocates are the engine behind all that we do, pushing forward policy change that now has our federal government recognizing the seriousness of celiac disease and moving towards funding research to accelerate new treatments and one day a cure. The great thing is that you don't need to be an expert in government or policy to be an advocate. All you need is your voice, your passion, and a commitment to making a difference, and we'll provide you with the resources and opportunities to make celiac disease the national priority it should be. Like some of the sessions before, there will be a short poll at the conclusion of this presentation that you must complete to earn your State Advocacy Ambassador certificate. After the poll, we'll conclude today with a Q&A session, so please enter your questions and comments in the chat box. If your question is not answered, please know that we will be posting to celiac.org a summary of questions and responses in the next few weeks. Let's start with a brief overview of what being a State Advocacy Ambassador for the Celiac Disease Foundation entails. The word advocacy means public support for or recommendation of a particular cause or policy. As a constituent, you are an indispensable part of our democratic system, and your voice has the power to influence Congress and its actions. The Celiac Disease Foundation advocates for policies on behalf of all celiac patients by working with the U.S. Congress, federal agencies such as the National Institutes of Health and the Food and Drug Administration, and state governments. Celiac Disease Foundation state advocacy ambassadors push forward policy change by educating their elected officials about the impact of celiac disease on Americans and why diagnosis, treatments, and a cure need to be a national priority. State advocacy ambassadors include patients, caregivers, supporters, researchers, and healthcare providers. No previous experience advocating to members of Congress is necessary to be a state advocacy ambassador. Everything you need to know to become an effective advocate will be included in this training. So why should you become a state advocacy ambassador? Well, the federal government is the largest provider of medical research funding, but up until recently, federal funding for celiac disease has been limited. Following CEO Marilyn G. Geller's testimony before the House Appropriations Subcommittee in April of 2019, Congress directed the NIH for fiscal year 2020 to devote sufficient focused research to the study of celiac disease. Congress renewed this language for fiscal year 2021. This request of the NIH will need to occur every year. In collaboration with our Advocacy Council from Baker Donelson, new language for fiscal year 2022 has been submitted. The U.S. Congress and federal agencies are making decisions that impact patients with celiac disease that can affect your access to medical care, as well as national funding for medical research. The best way to ensure that your needs are being considered in policy decisions is by sharing your story and explaining how specific policies will affect you or your loved ones. The Celiac Disease Foundation's 2021 advocacy priorities outline our future goals for the celiac community, as well as our current asks of Congress. These include medical research goals to increase funding for the National Institutes of Health for the study of celiac disease, include celiac disease in the Department of Defense's congressionally directed medical research programs, and to include celiac disease in the CDC's Diseases and Conditions A to Z Index. Our advocacy priorities also include important access to care initiatives, including to protect chronic disease patients from discrimination and bolster patient protections, extend Medicare and Medicaid coverage for medical nutrition therapy to beneficiaries with celiac disease, require disclosure of gluten in medications, and to increase FDA funding for necessary enforcement of the gluten-free labeling rule. In the email that was sent to you on Tuesday, there's a link to some of the documents we'll be discussing today. For those of you who didn't have a chance to download the documents or recently registered, we'll post this link in the chat right now. Members of Congress meet with a number of constituents daily, which can sometimes make it difficult for one person or cause to stand out in their memory. This is part of what makes leave-behinds so important. Leave-behinds are documents you give to the member of Congress or their staff member that provide important background information and statistics about the issue you're asking them to take action on. Leave-behinds are a great way to provide a lasting resource that the member of Congress can reference to be reminded of the key points of your meeting. Celiac Disease Foundation leave-behinds may be emailed or printed and can be found at iadvocate.celiac.org. These leave-behinds include a double-sided document that contains celiac disease facts and figures on one side and information about the foundation on the other that may be given to both senators and House representatives. Leave behinds may also include separate documents for senators and House representatives for any current legislation that needs our community support. As Dr. Verma mentioned in her talk, the Gluten and Medicine Disclosure Act of 2019 and the Medical Nutrition Therapy Act of 2020 were two such pieces of legislation. When reintroduced to Congress this spring, you'll find leave behinds for each. Here are the leave behinds on celiac disease and the Celiac Disease Foundation that you can download and email or print when meeting with your senators or House representatives. The About the Foundation page explains our current asks of Congress. For fiscal year 2021, we're focusing on securing NIH research funding for celiac disease and including celiac disease in the congressionally directed medical research programs. In fiscal year 2020, we also asked congressional representatives to co-sponsor the Gluten and Medicine Act of 2019 and the Medical Nutrition Therapy Act of 2020. When these are reintroduced this spring, we'll update the About the Foundation leave behind to include these asks. As a state advocacy ambassador, you'll receive a login and password to iadvocate.celiac.org to download these leave behinds. These are the leave behinds for the Gluten and Medicine Disclosure Act, introduced by Congressmen Tim Ryan and Tom Cole in 2019. There was one leave behind, H.R. 2074, that advocates gave to House representatives for the House version of this act, and another, S. 3021, that advocates gave to senators for the Senate version of this act. Celiac Disease Foundation constituents sent 28,000 emails to their senators and House representatives in support of this bill, gathering 53 co-sponsors. Co-sponsors are senators or House representatives who add their name to a bill, indicating their support. While the bill was not enacted into law, there are plans to reintroduce it in May in conjunction with Celiac Disease Awareness Month. Once this legislation is reintroduced, similar leave behinds for this act will be available to you at iadvocate.celiac.org. While all of the advocacy priorities mentioned previously are important to celiac disease patients, we ask that you keep your upcoming congressional meetings focused on the two asks we're currently working on for 2021 in order to make the greatest impact. The first of these asks is that Congress increase funding for the National Institutes of Health for the study of celiac disease. Better treatments and a cure for celiac disease can only be discovered through research. Most research is federally funded. However, celiac disease has been historically lacking in federal funding. The Celiac Disease Foundation has worked to secure fiscal year 2020 and 2021 appropriations report language, directing the NIH to devote sufficient, focused research to the study of celiac disease. Fiscal year 2022 appropriations report language has been submitted, and now it's time to gather congressional support to assure it is included in the fiscal year 2022 budget. For fiscal year 2020, NIH focused the May 2020 Autoimmune Diseases Coordinating Committee meeting on celiac disease. CEO Marilyn Geller spoke on what patients want and need based upon data from our iCure Celiac patient registry and your stories. Doctors Murray, Jabri, and Kelly presented on what research is needed to determine why people develop celiac disease, why there needs to be a treatment alternative to the gluten-free diet, and how solving celiac disease can lead to discoveries in many other autoimmune diseases. In December 2020, NIH invited the Celiac Disease Foundation to be a member of the ADCC, representing all patients with autoimmune disease. Based upon the testimony provided to the ADCC, for fiscal year 2022, NIH is hosting the Accelerating Research in Celiac Disease workshop on March 18th through 19th. This meeting will be open to the general public and will send you registration information as soon as it's available. CEO Marilyn Geller will be speaking on patient needs, so we will also be asking you to share your stories with us of why research funding is important to you. The goal of this workshop is to determine exactly what research needs to be done so that a Notice of Special Interest in Celiac Disease, dedicated funding for celiac disease research, may be issued by the NIH. While these are landmark achievements for the celiac disease community, this request for celiac disease research funding and recognition will need to be renewed on a yearly basis, making your emails to and meetings with your congressional representatives more imperative now than ever. Our second ask for 2021 is to include celiac disease in the congressionally directed medical research programs, more commonly known as the CDMRP. The CDMRP allows Congress to appropriate funds for research that will lead to cures or improvements in patient care for service members, their families, and the American public. These funds are separate from those provided by the NIH. Demographics support the estimate that thousands of active Guard and Reserve service members are currently suffering from celiac disease or are in danger of developing the disease, making them eligible for service-connected disability and ineligible to continue to serve. TRICARE is government-funded insurance for service members, veterans, and their families. Based upon TRICARE covered lives, it's estimated that an additional 77,000 retirees and family members may also suffer from celiac disease. CDMRP funds provide another opportunity for research to benefit those suffering from celiac disease by generating strategies to prevent the disease, and for service members, providing critical guidance on mitigation efforts affecting readiness to allow our service members to continue to serve. The Celiac Disease Foundation, in collaboration with our Advocacy Council, Baker Donaldson, has submitted a fiscal year 2022 request to include $12 million of CDMRP funds for celiac disease research. Like for NIH funding, we ask that you encourage your congressional representatives to support this. Two of our 2020 policy priorities are awaiting reintroduction in Congress for 2021. The Gluten and Medicine Disclosure Act is a bipartisan bill that will require drug manufacturers to label medications intended for human use with a list of ingredients, their source, and whether gluten is present. This bill is planned for reintroduction to Congress in April or May of 2021. The Medical Nutrition Therapy Act is a bipartisan bill that would provide coverage of dietitian visits for Medicare beneficiaries with celiac disease or other conditions. This bill is planned for reintroduction to Congress in late March of 2021. When introduced, we'll prepare new leave-behinds and ask you to engage your networks in email campaigns to Congress and to set up meetings with your senators and House representatives in your home state to gather co-sponsor support. Your personal experience with celiac disease is the most powerful advocacy tool you have. Your story gives you a unique perspective on the hardships celiac disease patients face, and it creates an emotional connection to the issue for legislators. In the email sent to you, we provided a link to crafting your story to affect change. You'll also find this in the Advocacy Toolkit at iadvocate.celiac.org. Use the tips, prompts, and example of an effective story in this document to help you effectively share your story, and remember to relate your story back to our asks for 2021. Here's an example of what an effective story might look like. As a celiac disease patient, the travesty is that the only treatment for my disease, the gluten-free diet, is inadequate and leaves millions of Americans suffering needlessly. I live in constant fear, knowing that ingesting just one tiny crumb of gluten will trigger debilitating illness and increase my risk of cancer, heart disease, and additional autoimmune disorders. Please support NIH funding for celiac disease research for fiscal year 2022 in order to develop new treatments, find a cure, and help improve the lives of patients like me. In the Advocacy Toolkit at iadvocate.celiac.org, you will find resources including how to set up meetings with your legislators, where you'll find information about your legislators, review our sample script for requesting a meeting, and make the most out of your interactions with members of Congress. You can meet with your members of Congress by calling, emailing, setting up an appointment at one of their district offices, or attending a town hall meeting or other public event. During the COVID-19 pandemic, members of Congress and their staff may also be offering virtual meetings. If your congressional meeting ends up being with a staff member rather than the member of Congress themselves, continue to treat the meeting with the same level of importance you would give to a member of Congress. Staff are often the people members of Congress turn to for advice, making them extremely important in guiding policy decisions. When advocating to members of Congress, it is important to clearly explain the action you would like them to take, the asks. This may seem obvious, but many legislators have said it can be frustrating to meet with constituents who don't know what they're looking for. Remember to tell your celiac story to explain why our asks for 2021 are important to you as someone with celiac disease. Sending a thank you note after your congressional meeting to express your gratitude can help build a professional relationship. See our legislative meeting thank you note template in the Advocacy Toolkit for an example of an effective thank you note. After your congressional meeting, it's important to keep in touch with the member of Congress and their staff through emails, visits, appointments, and letters to keep celiac disease issues on their mind. Look for positive ways to engage your members of Congress, such as tagging them in social media posts about celiac disease or sharing Celiac Disease Foundation emails with them to show how research is improving the lives of people with celiac disease. One of the simplest steps you can take as a state advocacy ambassador is to email your congressional representatives using the Celiac Disease Foundation's Take Action Center on celiac.org. Under the Get Involved menu, click Contact Your Members of Congress or use the URL celiac.org/takeaction, and you'll find a pre-written email that you can personalize for each of our current asks of Congress. When you enter your voting address, our advocacy software will display your representatives and email them on your behalf and allow you to share with your networks through social media and email. One of your most powerful advocacy tools is something you might already use every day. Social media is one of the most effective and efficient ways to spread awareness of celiac disease to your network. Our social media toolkit contains sample posts with important facts about celiac disease that you can use to educate your followers. Remember to tag the Celiac Disease Foundation in your advocacy posts and like and follow us on social media. If you have completed all the polls, including the one after this presentation, on March 23rd, you'll receive an email asking you to sign up to be a state advocacy ambassador at iadvocate.celiac.org. Once you have signed up and created your username and password, you'll be able to log in and download your Celiac Disease Foundation State Advocacy Ambassador Certificate. Under the Resources tab, you'll find the Advocacy Toolkit, the Celiac Disease Foundation State Advocate Forum, and the Advocacy Action Calendar. The Advocacy Toolkit contains the resources you need to meet with your members of Congress as a CDF State Advocacy Ambassador. The Celiac Disease Foundation State Advocate Forum will connect you with like-minded celiac disease advocates to build your network and share ideas. The Advocacy Action Calendar provides you with monthly ideas on how you and your networks can easily advocate. When you receive your email to sign up to be a state advocacy ambassador, complete your address information. Be sure that the box that says, "To become a state advocacy ambassador, I agree to receive Celiac Disease Foundation emails," is checked before clicking sign up. Once you sign up, you'll receive an email to create your iadvocate.celiac.org login ID and password. Under the Resources tab, you will find everything you need to ensure your success as a state advocacy ambassador. You will also have access to the online training program videos and slides from this presentation if you need a refresher. Once a month, we'll send you action alerts, training opportunities, and ways you can support the Celiac Disease Foundation's mission to accelerate diagnosis, treatments, and a cure for celiac disease. This calendar contains action items that coincide with the legislative calendar to strengthen your advocacy efforts. Here are some of the ways you can show your support. The biggest obstacle in getting a celiac drug to market is recruiting enough patients to participate in clinical trials. Share our Participate in Research page at celiac.org/participate-in-research with your network. Share Foundation social media posts and our monthly e-newsletter to promote awareness of celiac disease as a serious autoimmune disease. Check the Eat Gluten-Free app for the latest news on all things celiac. Call or email your members of Congress and their staff on a regular basis to stay in touch and build a relationship over time. Each month, we'll feature an advocacy ambassador in action. We encourage you to share your experiences and pictures with us so that we can follow up in Washington, D.C. on your state activities. We also provide you hotline support and welcome your emails and calls. Once you have signed up and logged into iadvocate.celiac.org, you'll be granted access to the iAdvocate Forum, a place where celiac disease advocates from all 50 states can collaborate, share advocacy experiences, and plan meetups with other advocates. All forum users must read the terms of use carefully to ensure this space remains inclusive, contains accurate information, and is free from personal promotions. Please join the forum and introduce yourself. Click on the topic threads for specific policy priorities or the thread specific to your state or region to communicate with other celiac disease advocates in your area. State Advocacy Ambassador Kelsey Smith is our forum moderator. Kelsey moderates the forum by answering questions and posting prompts for advocacy ambassadors. You can introduce yourself to Kelsey in the forum, username Celiac Disease Foundation Moderator, and let her know what forum topics you'd like to see her post. To use the iAdvocate forum, click on the Introduce Yourself topic thread and introduce yourself and your connection to celiac disease. Use the NIH research topic to post activities and comments related to NIH funding for celiac disease research. To connect with other advocates in your own state, go to the forum for your state and start networking and planning your state advocacy efforts. To conclude this training, here's a checklist of the next steps you should take as a Celiac Disease Foundation Advocacy Ambassador. Complete the polls, and when your Celiac Disease Foundation State Advocacy Ambassador email is received, sign up at iadvocate.celiac.org and log in to receive your certificate. Join the iAdvocate forum and start connecting with other advocates near you to plan team meetups to visit members of Congress in your home state and share your efforts. Download the Eat Gluten-Free app to easily stay informed about our work in recent celiac disease research. Complete the monthly activities in the Advocacy Action Calendar to continue your important advocacy work. Educate your network about celiac disease using posts from our social media toolkit. Send pictures you take with your members of Congress and tell us how your meeting went by emailing sierra.manning@celiac.org. And lastly, attend the annual Patient Education and Advocacy Summit every year. Thank you for attending the Patient Education and Advocacy Summit. Remember to successfully complete the poll that follows this video to become a state advocacy ambassador. Submit any questions you have for the Q&A in the chat box. We'll get to as many questions as time allows. Details regarding the $25 gluten-free lunch reimbursement will be emailed to your registration email address for participants who completed all polls. Thank you for joining the Celiac Disease Foundation State Advocacy Ambassador Network. We look forward to working with you to advocate for a better future for all celiac disease patients.